Treating patients for sleep apnea is one of my passions. Sleep apnea only happens while you're sleeping, and apnea means no breath. So it's not breathing while you sleep. It is the condition of not breathing while you sleep. With adults, there's more of a range with how many times you can obstruct or be without breathing, and you get mild, moderate, or severe. In a nutshell, there are different levels of sleep, from stage 1, 2, 3 to REM sleep. That's one cycle. That should happen 4 times in the night, and each of those cycles is about 90 minutes. What ends up happening is that when you wake up in the morning the next day, you didn't cycle through all the levels of sleep that you should have. The levels of sleep are important to cycle through because in each level of sleep, different things happen to restore your body and your brain, your muscles, your tissues. Different hormones are released. Typically, sleep apnea happens because the person or the child is lying back or on their side in a certain way that the person's jaw will kind of like just hang open. The tongue can kind of just fall into the airway and begin to block the airway. There can be a total blockage, or there can be still a little room for the air to pass through. What happens to the person when they have difficulty breathing while they sleep? The brain notices that oxygen's not coming in and carbon dioxide is high, or those receptors also notice that there's a struggle to breathe. The brain will notice that effort to breathe, and the brain will wake up the patient. Now, the person will wake up from a certain level of sleep that may be a deeper level of sleep. Sleep actually is a very vital function in living. And to be honest with you, I don't think that there's any number of times that are okay to not be able to breathe while you're sleeping and to be woken up. You need to be able to not have any times during the night that you couldn't breathe so much that you were woken up. Common symptoms of sleep apnea are snoring, gasping for air, frequent turning in the night, waking up the next day feeling like if you're not rested, even insomnia, high blood pressure, diabetes, weight gain, gastric reflux are among some of the symptoms you may be having or conditions you may be suffering from. I also recommend sleep studies to be done. I'm able to recommend sleep studies to be done and to give patients a monitor that they take home and they use in their own bed while they sleep. I have one for adults and I have one with connections for children. In the state of Florida, dentists have to work with a sleep doctor to give the diagnosis of sleep apnea. We treat people for sleep apnea all the time. People are thrilled with the appliance that I use. It's a little upper and lower mouth guard that kind of fit together in a certain way that don't let the lower jaw fall back into the airway while the person sleeps. It holds the lower jaw in a safe place, protects the airway. That's what I use to treat sleep apnea. So I find myself to be very fortunate that I'm able to treat sleep apnea in a way that is very easy and user-friendly and convenient to get the person the help they need.